Gottlieb, now former FDA Commissioner, CNBC contributor, board member at Pfizer and Illumina. Doc, good to see you. Let's start with schools. Do you see a scenario where the virus forces them to go fully remote again during this school year?
Unfortunately, it's possible, especially if we go into this school year without the kind of mitigation that we had in place last year. We can't expect to have less measures implemented in terms of trying to control the infection in schools and expect the same result in terms of keeping the infection at bay. So masks are one option, one tool that schools should be looking at. There's other things they could be doing. Keeping children in defined social pods is important so you don't have an outbreak across the whole school. Trying to use testing more effectively. A lot of school districts are implementing routine testing. Making sure you retrofit air filtration systems and try to get better airflow into school, and keeping kids in as small social compartments as you can within the schoolhouse. So there's a lot of things schools could be doing. I think, unfortunately, a lot of schools are taking their foot off the brake before the school year begins. And we don't really know what the circumstance is going to be. This is a much more contagious variant. It might be much more difficult to control this in the schools. So the goal should be to keep schools open and try to keep these measures in place until we see how it goes.
Well, you heard the Florida Governor DeSantis say it's perfectly reasonable for a parent to want to send an unvaccinated kid to school without a mask. He said parts of his state are seeing a flattening in the cases and that he is happy with the trend. Is that accurate? And might we be heading to the other side of this Delta surge?
Well, look, the surge in the South is certainly peaking. There's evidence that cases are starting to decline on a daily basis across much of the South, Arkansas, Louisiana, Missouri as well, in the Midwest, and Florida as well. But just because cases are declining on a daily basis, and you think we're going to see a continued trend towards that, doesn't mean you're not accruing new cases every day. We're going to continue to accrue new cases even as the case count starts to come down. And unfortunately, they've maxed out their healthcare system in a lot of states in the South, and they're going to continue to see hospitalizations rise even as cases continue to fall. Part of the challenge is that COVID patients who get admitted to the hospital stay longer. So it's hard to discharge a lot of these patients, particularly when they get admitted to the ICU. So to the extent that many hospitals are pressed right now and they've maxed out some healthcare systems, that strain is going to continue for weeks to come.
Quickly, on kids 5 to 11, American Academy of Pediatrics is pushing for the FDA to approve the vaccine already. Do you agree? Support that?
Well, look, I think what the FDA is doing is they're asking for more data. So the American Academy of Pediatrics sent a letter to the agency about the expansion of the clinical trials. I think the FDA is asking for more data, but if the circumstance changes and the situation worsens among kids, we see outbreaks among kids, we see worsening outcomes, I think the FDA is going to be in a position to make an earlier decision if they have to from a public health standpoint. But they're trying to get more data to support that decision, so they've required longer and larger clinical trials, and that's why the timeline's gotten pushed out a little bit.
Shep Smith here. Thanks for watching CNBC on YouTube.